The health workers are few. The patients are many. We've been noticing the lines since morning. They've been rather long. Now they have reduced. Now, how possible is this? Health workers tell us that they come together, those who are not operating somewhere else, including midwives here, to make sure that this line gets shortened. Even the support staff is included in this, at least to do a recording somewhere. The same is also happening at the main hospital.
Teamwork is making us move on, because we know if one person is not there, somebody have to come and cover, such that we don't have that major gaps. Because on the forefront, why we are here is for our client. If this client go back minus getting the service, is quite disappointing. Others move some good distance, being the general hospital.
Why aren't there patients anymore?
We normally join hands. I mean, when like the midwife, the maternity is not busy, because we normally get responses are many. The attendance differs per day. Like today, she went to OPD and helped us to clear up the patients. Actually, she was dispensing, because she's capable of dispensing the medicines, and I was seeing the patients.
The Ministry of Health says often teamwork produces results in a fluid working environment. However, the Permanent Secretary, Dr. Nwoya, says it should not be the practice.
And they are supposed to operate 24 hours. I know some services may close. Outpatients sometimes are replaced by emergency care at night. Interim occasions like where there is an accident, where there are massive patients in one service center, yes, you can get the staff from other units to support one unit, but this should not be the normal process.
However, UNISA team health worker at Alero says barely do patients come to the health center at night. Dr. Nwoya says the health center should have a fully functional casualty unit fitted with beds where patients who are seeking treatment can spend the night.
They should be open 24 hours, holidays or not holidays, because health service is needed every time.
A team says the lean team at the health center is able to finish the workload because of its versatility and team spirit.
So by 3 almost. Yeah, 3 almost done. Although on Monday, there was a Monday, some 3 weeks, we could go at 5:30.
Justin Ongea, who is the laboratory assistant, has had a hectic schedule since morning. But because of hard work, he's about to wrap up the day's chores. But he has to join his colleagues in the ad hoc outpatient department. Even the guard here is kept in the loop of things. Sometimes he has to help with records of patients. However, these overlapping roles assigned to health workers and the attempt to juggle many roles at this health center is not a good practice, according to awareness groups like the Action Group for Health, Human Rights and HIV/AIDS, AGA.
So it creates conflicting choices for health workers. At times they can decide to serve in OPD and leave the maternity section. At times they can serve in maternity and leave the OPD.
It has been a long day here, and the last batch of patients are being attended to. Only a young boy with a wound is left at the OPD, as the benches where patients await treatment are glaringly empty. It is 3 p.m. and the guard closes this section of the health center.
No, it is not supposed to be closed. Why? Because the patients don't have the pattern of coming. Yes, you can know that the patients are usually many in the morning hours, but a serious patient can come at 5 and he will need services.
When they're not very sick, they go dig, then they come. So if someone leaves for garden like at 6:30, by 10 you will have done with the digging. So they normally respond from 10 going to 1, can be many. But if we join hands, you find they go fast.
The workers at the health center look forward to another day after a busy day.
Like me, I'm an enrolled comprehensive nurse. I can come and help her with recording, taking BP if I'm not busy in OPD.
You find one staff is carrying out responsibility for more than one person.
After recruiting close to 8,000 health workers within the country, I would expect that those scenarios should not be common now. We have done the countrywide recruitment. I know we didn't get 100%, but we got more than 70%.
Apparently, the 30% is what is needed in areas such as Nwoya. The district general hospital also has a staff shortage. In a place supposed to have 191 staff, there are only 89.
Ideally, we are supposed to have 7 medical officers, which currently we have only 2.
May not be because of lack of staff, but health units where almost 80% of the staff are allowed to go and leave.
But even with alarming staff shortages, health workers at Alero continue to serve the community diligently. Upon completing the day's task, staff here stay at the premises to attend to any patient who could come by. Florence Salimba, NTV.